All
right. Good afternoon, everyone. My name is Tina Sherman. I am Senior Campaign Director here at Moms Rising for Maternal Justice. And I am so happy to be joining you all today to talk about fibroids, breastfeeding, and maternal health. Thank you all so much for joining us. More than 26 million women across the United States are affected by fibroids. And we are joined by Dr. Danett Bean. She's a doctor of acupuncture, Asian medicine, and she is joining us today to talk about this very important issue. Thank you so much for joining us, Dr. Danett.
Oh, thank you so much for having me. It's such an honor. I'm such a fan of Moms Rising and all the work that you do. So thank you so much. It's a privilege.
Thank you. Well, we're gonna start with a really simple question. When I told friends that we were doing this conversation, they were like, "Really? We need to talk about this," but we don't ever talk about it. So let's start with the basic. What are fibroids? Like we all kind of hear it. Some of us experience them, but can we talk about what they actually are?
Yes. So fibroids are benign tumors of the uterus. And so benign meaning that, typically they're considered to not cause so many problems, as opposed to malignant, which nobody ever wants, which is more infectious and can, cause problems, deterioration of the body. So in a way, fibroids, I was thinking about this. Fibroids are kind of like Steve Urkel, like back in the day, like Family Matter. Like you can't get more benign than Steve Urkel, right? And
Yes.
malignant would more so be like Nino Brown or Killmonger, right?
Okay. Right.
Um, but the interesting thing with fibroids is that even though they're benign, they can cause a hell of problems, right? Like lots
Yeah.
of pain, pelvic pain and pressure, problems with bowel movements, fertility and pregnancy issues. And of particular note is heavy bleeding,
Mm.
anemia, and women with fibroids and heavy bleeding oftentimes exercise less.
Mm.
So anemia and decreased physical activity are all risk factors towards cardiovascular events. So it's
Ah.
never talked about. It's all indirect, but it's like this can cause this, which makes us
Yes.
more likely for that when we're already more likely for so many
Right.
things. So we don't need that. Um, and then from a traditional Asian medicine perspective, which that's all my scope, I'm not a Western medical doctor, but fibroids, we think of them as being related to a lack of proper blood flow of
Mm.
the womb. Sometimes the chi or energy, a lack of flow, phlegm can
Hmm.
also be a factor that, and then also always involved is a lack of energy or a lack of chi for the body to be able to handle it properly. And it all goes back to the number one cause in according to traditional Asian medicine with fibroids is emotional strain, resentment,
Mm.
hatred, that sort of thing. And so that and then diet is a factor as well. So it's interesting. We can help because we have a clear cause, and traditional Asian medicine's been around for thousands and thousands of years, helping women to decrease and prevent fibroids. So when you understand a cause, you can do something. So those are my two answers. There's, what it is in Western medicine, but then also looking at it through the lens of traditional Asian medicine.
Yeah, and I think what you just said, the stress and how that plays a factor really resonates with me. And when we think about the populations that are most affected, and that just brings me to, and if I'm just being blunt, um, what does being a woman and being a Black woman or a woman of color, how does sexism and racism affect our awareness around fibroids, and also other issues affecting our health? I mean, I feel like you just named right there the things, but the other thing that's kind of the elephant in the room that we're missing is how are sexism and racism affecting our awareness and treatment? around fibroids?
I'm so thankful for this moment because when I first got out of acupuncture school, this was before I did my postgraduate work. This was in the early 2000s. A simple conversation like this was like not heard of, right? Because it's
Mm,
like that link between racism and health, it's like if you had that conversation, it was like militant, as opposed to it's just
mm,
statistics, it's just facts, it's
yeah,
just numbers. And the question really is, when have we not been stressed?
right. Exactly.
Has it ever
Exactly.
stopped? It has not. And so
Right.
I believe that a lot of what we contend with are things that our ancestors did not get to heal from in our more recent legacy of slavery. We internalize things, and if we don't get to heal from it, then it gets passed on. And we have this whole science of epigenetics, which genes get turned on versus not. But if certain things are passed on to us, and then our environment, between environmental pollutions, hormones, and food, just the stress of daily living, it all just compiles, and that's why the numbers are so ridiculously high. And,
Right.
for racism and sexism, I was thinking about this. It's just like if someone designs an apartment or designs a house and they make everything, about 12 inches, right? The
Mhm.
closets and the fridge and the stove. Well, maybe it would work for who created that. But for other people who come in, it's never going to be vast enough, wide enough to really address our needs. And so
Right.
the history is, from my knowledge of the medical system in the United States, was not created in thinking about women or thinking about Black and brown people. And so it's, that's a large part of what we're dealing with. So funding and research has over the years, gone into all sorts of things. I mean, how many times have we sat and watched a drug for impotence on TV?
Right.
I mean, since for years and years, and that's so great that there can be help, but there's many other things. And so part of what's happened with the awareness and conversations around fibroids is it's so common, right?
Mm,
And because
mhm.
it's benign, because the fibroid itself is benign, it's like, well, we have many other things to worry about. But
Right.
in the but lined up in a particular way, right? I'm trying to think of a Family Matters episode where Steve Urkel really messed things up, right? In the
Yes.
wrong situation, the house could burn down, right?
Right.
So there hasn't been and then the other part to it is there hasn't been in mainstream medicine, what can we do about it? Usually
Right.
it's like, okay, well, let's ride it out. It's what I call the waiting game. It doesn't bother you, so don't bother it. But there are, physicians who state clearly that it might be a smarter thing to try to address it rather than wait. So it's been this culmination of,
What a concept.
I'm sorry,
What a concept
what a
to try to
concept.
address it instead of waiting. Yes.
Right.
What a concept.
Right, right. So it's a culmination of how the system was set up, to not think about women, to not think about Black and brown people, along with it being benign, and along with where the focus and resources have gone. And it being so common, it's like, okay, well, and then,
Yeah.
years later, if it's gotten bigger, there are problems. There can be
Yeah.
problems from that. Yeah.
I will share that I was in a conversation last week in which we contemplated just starting all over with the healthcare system and starting from scratch
Yes.
because it has not been built
Yes.
to accommodate. And I love your description of the 12 inches. It has not been built to accommodate women and Black and brown bodies, Black and brown women. And so, where do we go from here if we don't blow it all up and start over? So, since that is not our current path um, in which that we can go down, that one we'll contemplate here. Another conversation for another time. But but I would love to hear your thoughts on in the current structure that we are in. How can we begin to treat the whole woman and the full spectrum of maternal health. We are clearly missing the boat. Again, so grateful that all of the individuals who are affected by erectile dysfunction are able to seek treatment. That is wonderful. Kudos to them and to their partners. However, we have a whole host of women who are battling this, and a whole host of other medical issues that we are saying it's okay. It can ride. How can we begin to really address the issues that women face throughout their reproductive lives in a more holistic fashion?
Yeah, such a great question. I mean, it's the work that Moms Rising is doing. It's these conversations. I think that what's extremely important is that we try to remember that we're multidimensional beings. We're physical, we're mental, emotional, if you will. Some would say we're spiritual. And our healthcare has to reflect that. I think that we all need an integrative medical team because no one can see everything all the time. Whoever thinks that is very egocentric, and we don't have time for that. If we really are caring about women and Black women, and we want to brown women, and we want to make changes, then we have to have all hands on deck. So I am in full support of making sure that all hands are on deck, and that all organizations, if they don't have it, organizations, clinics, anyone who cares about and is working to improve the health of Black and brown women, to incorporate other therapies and do advocacy around that so that that can be available. For instance, I do pre-birth acupuncture. I'm located here in Brooklyn, New York, and there's research, and it's been being used in places in Europe for many years, where it can help to improve cervical ripening, improve labor efficiency, decrease the need for medical interventions. There's all kinds of things that can be incorporated. So I strongly urge this idea of not, saying, okay, this isn't mainstream medicine. Let's come back to it. We have research-based things that have been helping women. So I think that that's a really, really important part. Is integrative. Yeah.
Yeah, absolutely, absolutely. Thank you for that. We are just coming off of National Breastfeeding Month last month, and I would love to hear more about how fibroids can affect our breastfeeding journey. I might expand that a little bit out to talk about, just earlier this week, the CDC announced that 80% of maternal deaths are preventable. And so I'm wondering what are the thoughts on both affecting our breastfeeding journey, but that inability of our current structures to address women's healthcare needs. How is that failing us more broadly, and what could we do about it?
Yes. Yes. So important. So for fibroids, there's a couple of ways to think about this, but for women, say for instance, who may have had heavy bleeding, right? We say in traditional Asian medicine that the breast milk, the source of it is blood, the energy of the blood, right? Mm-hmm. And so if there's a woman who's had fibroids with a heavy cycle, or just has had heavy cycles, or has had, so that can affect her lactating, but then also stress, because of how that affects the channels. And then also, if a woman has a fibroid, potentially based off of the size and the location, it can affect the channels that run through the breast as well. So that can be a factor in terms of how fibroids can potentially affect the breastfeeding journey. In terms of the maternal health statistic, I mean, I think that we have to do, again, all hands on deck. But I think that part of the issue is that maternal morbidity has been completely in so many arenas overlooked.
Yes.
You know, when I was doing the research for my book, I wrote a book, A Taste of Our Own Medicine, all about preventing postnatal depletion.
We're going to drop that in the chat for folks
Yes,
that are listening.
yes.
Thank you.
At the time when I was doing my research, how it was being said was that anything after 42 days of giving birth could not be related. If there's a health issue, that it could not be related to it if it was 43 days after. And we know now that something very different is being said, right?
Yes.
And so
yes.
it's been said that while maternal mortality is awful, it's the tip of the iceberg, and that the actual iceberg is the maternal morbidity. And so what that is that it's complex. It's any condition, health concern that can happen as related to pregnancy or childbirth that negatively impacts the woman's well-being. And it's a lot of things. And it takes a lot of work. And so this is the thing in terms of integration, for traditional Asian medicine and other indigenous medicines. We are really good at helping people with chronic conditions. This is where we shine. I can't speak for each medicine, but I'll speak on traditional Asian medicine. We shine at chronics. If somebody, let's say, has an injury, is an emergency, thank God for Western medicine. We have to figure out how to bridge it, right?
The integration.
I'm a morning person. My husband's a nighttime person. Our son knows this. He wants something in the morning. He comes to me because, I'm happy in the morning. At a certain point at night, I'm done. He goes to his dad. Everybody, it's working together so that the people who are affected can have the most benefit. And so I personally believe that until we have more of a handle on maternal morbidity, I think that's going to provide more details around just women's health. And then I think also we talk about how women go in cycles of 7. And so what things we can do to support women at each stage. This is part of prevention, right? Prevention, like, thank God for mammograms, right? You can do
thank God.
To see, right? But then prevention is also like, what are the things that we can do so nothing's detected? We have to hone in a lot more on what prevention means. And lab work is key, but there's also what people say. There are so many women who've gone to their doctors and practitioners and said something's wrong, but because nothing has showed up on the labs, then nothing's wrong. But the labs are not God, right? There are medicines, traditional Asian medicine, we're able to pick up on things on an energetic level through thousands of years of research of pulse, tongue, answering. So if a woman says something's wrong, something's wrong. So that's the first thing. We have to start there. And then we have to understand that this is more complex than just something we can throw a pill at. If we can throw a pill at it, if a pill can be thrown at it, then it's real, and then we can do something about it. But if it can't, then, maybe you should get some psychiatric medications, which I'm not downing that at all. But it's like, you have to get to the root, or else we're going to continue to be on the same path.
And I think one of the things I really, really appreciate that. And I think I think the converse side of that as well is that there is such a range of normal, and understanding what that range of normal is, that along prevention lines, sometimes Western medicine isn't going to pick it up, but sometimes if we were better integrated, there are ways to prevent complications in the future, so that it's not showing up, either, sort of in either arena. And I think that's really important to name as well, that like there is just the range of normal, but when we're not talking about them, what the range is, then that also becomes an issue as well. I really appreciate your focusing on the integration and the importance of integration. It is not one side versus the other. It is the importance the two coming together to meet the needs of the individual, who is the one who's experiencing the issue and the concern, just the importance of that.
Absolutely, absolutely. And I think also making sure that there's proper replenishment and strengthening during the postnatal time, that can also help with subsequent pregnancies in terms of the health that the mother is in coming into it. There's a lot that can be done. There's a lot.
Thank you. Thank you. I really appreciate this conversation today. Again, I kind of opened with like, it's sort of whispered about and talked about, my mom, my sister, my uncle, like my cousin, talk about it. But we don't really dig into what does it mean? How is it affecting the woman, and what are her options? I would love if you could share some resources. I know we're going to drop some in the chat that you have that we can direct folks to, and also if you can let folks know where they can find you, so that if any questions come up and if they're looking for additional resources, they know where they can find you.
Absolutely, absolutely. I want to just say something you said made me think of this, but I think it's really, really important to always make sure that that we're having our regular well women's care visits and all follow-up visits. It's essential. And if we don't have a practitioner that we feel comfortable with, that we work to make sure that we have one, because we have to have that. In terms
Thank you for that.
Yes. In terms of resources, I have a fibroid prevention guide that I wrote that just gives some information about the different types of fibroids and things and ways to understand the causes of it and things that can be done. It's a free download. So when you go to my link tree, you'll be able to see that there. And I have some different goodies on there. I have the link to the book I mentioned, Taste of Our Own Medicine. I do complimentary evaluations as well to see if I can be of assistance or potentially refer if necessary. And then I also have something I call the Healthy Mamas Report, where once a month I get together with a group of mothers and talk about different topics that are pertinent to our health, and also just as a check-in, because we need that. It's so easy to put it on the back burner because there are other things, but so that's available.
There are always other things, but the importance of centering ourselves, right? So critical. I do want to open the conversation up, encourage folks to drop into the chat. Again, you go to the chat, you can find exactly where to find Dr. Danett, but want to lift up questions in the chat that are coming up. So please drop your questions in the chat. And our first question we have here is from April Silver. She wants to know, what are the things that some folks often get wrong about traditional medicine overall, especially for women? Thank you, April.
That's a great question. What do we get? What is traditional medicine? I assume you mean like traditional Asian medicine, not traditional medicine in terms of mainstream, but well, okay, I think I get it. So yeah, I think that people don't necessarily understand the vastness of treatment options. I mean, we have like hundreds, thousands of, formulas. We have lots of different herbs, but different combinations, and in many ways to be able to see an individual, woman. And so I think that, sometimes people just feel like, oh, for instance, acupuncture. Okay, if I'll come see you if I have low back pain, which is fine. But there's so many more things. And part of the issue is that for a lot of us, what's common becomes healthy. And that's not necessarily true, right? Somebody can wake up each day and start walking and their knees bothering them. And it's common for them or everybody in their family, or when it gets to be there, but it's not necessarily healthy. And so I think we have to step back a bit more to really think about what optimal health could look like, and make sure that we are not just sort of like, oh, well, that's the way it is, but really getting assistance and support for the things that are out of alignment. So I think that's some of the things that people, don't quite understand how many things we can help with, like PMS or anxiety or um, healthy weight management. So many different things because we address the body's natural healing intelligence. And so in mainstream, we don't really talk about that
Yeah.
the body has its own natural healing intelligence. No, it doesn't. We'll let you know what your body says. The body tells
I
the body tells you what.
I have not heard that before. I know we're coming on time, but I have not heard that before. So I'm going to check the chat really quick. And again, I'm going to give folks just a second if they want to drop in, but can you tell us a bit more? I haven't heard that before. Of say it again, natural body intelligence.
Yeah, the body's natural healing intelligence.
Tell us about that.
Yeah,
We'll do that as our last question.
sure. So for example, right, if I had a cut, right, the different white blood cells would know to come to like handle what was going on, right? That's one example of the body's natural healing intelligence. But when we have different symptoms that are different for us, the body's healing intelligence is giving us an indicator that something is going on. But when we feel pulse, right? When we put a needle, an acupuncture needle in, or change your diet, and the body is able to then use its own wisdom to direct it to where it needs to go, that all comes from somewhere. That comes from what our bodies naturally do. For instance, as babies, we were all naturally belly breathers. That was natural and healthy. That oxygenates our cells and nourishes our kidneys, which is the root of all the other organ energies, we would say. But over time, it becomes more shallow. So we stop listening to it and start doing more of what's going on around us. So those are some
Thank
examples.
you.
Yeah.
I'm feeling another conversation coming on because I want to talk a little bit more about that. And I'm thinking specifically about that prenatal period. But we're going to save that conversation for another time. I really appreciate you joining us, Dr. Danett, to talk about fibroid awareness, to bring this conversation to light for our moms and our dads and our uncles and aunties and families that are watching. Ones who'll be able to go back and watch us later because yay for technology. Want to invite folks to click through the chat. We've dropped in how you can find Dr. Danett and a handful of resources. And I could not close this out without encouraging folks. My role here is to talk about what public policy solutions there are that are out there. And you raised up several different pieces that are addressing maternal health, whether it's social determinants of health, whether it's access to being able to have access to health insurance. So I'm gonna encourage folks to sign on to support the Black Maternal Health Momnibus. That is a collection of legislation proposed by Congresswoman Underwood and Congresswoman Alma Adams, and Senator Cory Booker. That is all in support of Black maternal health. It is pending. It has passed the House. Yes. Parts of the bill have passed the House. It is pending before the Senate right now. So you could sign on to our petition and encourage your senator to support that bill. So Dr. Danett, really appreciate your time this afternoon. Thank you so much for chatting with us. And thank you all for joining us for this conversation. Hope everyone has a great afternoon.
Thank you so much.